Hi, my name is Mary Worth with the Baptist Health System. February is Cardiovascular Month, and we've talked a lot about heart attacks, symptoms, nutrition, things to keep you healthy. And today I wanted to talk a little bit about vascular disease. With me today is Dr. Pollard, the Cardiovascular Surgery Director for the Baptist Health System. Thank you, Dr. Pollard, for being here.
Thanks for having me.
So I have a few questions, and I think most people think of just heart attacks around Cardiovascular Month, but I wanted to talk a little bit about the valve disease. What is a heart valve? Let's just start there, and what's its function?
Well, I guess simply put, a heart valve is basically a one-way door within your heart. There are actually 4 of these valves within your heart, 2 on the right side of the heart as blood passes to your lungs, and then 2 on the left side of the heart as blood comes back from your lungs and then is distributed or pumped out of the heart to the rest of the body. Typically, it's the left-sided valves that we talk the most about because they're the ones that are working under the higher pressure, and because of that, they're more prone to having abnormalities.
How do these valves, how often they open and close? What's a normal?
Well, they open and close with every heartbeat, and so when your doctor puts his stethoscope on your chest, he's basically listening to the sounds that those valves make as they open and close. And there can be abnormalities with that. You can hear different sounds that may clue you in that something's wrong. Obviously, to identify that and to verify that, you have to usually have more testing performed, usually more testing like echocardiograms and things like that, to be a sonogram of the heart to know if something is truly wrong with one of those valves.
And what causes heart vascular disease, or what are some symptoms that somebody might have?
Well, speaking specifically about valve disease, there can be different symptoms related to that, and unfortunately there are things that sometimes can mimic other conditions. The most typical symptoms of heart valve disease are things just like not feeling well, just being tired and fatigued. Some patients can get short of breath, chest pain can be a symptom, and then even a later symptom can be something more serious, like even having passing out spells.
Can heart valve disease be fatal? I would imagine that they can if you don't take care.
Well, it certainly can be, and people always think of cancer as being something that would be a definite life-threatening thing to your health, but valve disease can almost even be more serious. If you, for instance, aortic stenosis. If you have aortic stenosis diagnosed with symptoms, within 2 years, 50% of those patients will have passed away if they don't get treatment, and in 5 years, over 80% of those patients. So that's really something that progresses, again, more rapidly than even some cancers do. So when these symptoms start, it's important to see your doctor and to get that addressed.
What are some options for treatment?
Well, that's really changed a lot. Initially, even in the dark ages when I came out of my training, obviously most heart valves were treated with open surgery, open chest surgery, where a patient would have an incision down the front of their chest. The heart would be connected to a heart-lung machine, and then we would open the heart, take out the diseased valve, and replace it with a new one. But a lot of things changed over the years. One is it became possible to not always have to replace the valve, but just repair it. And there's a lot of advantages to leaving your native tissue there and just repairing the valve. And then even more advances came along where we could actually do the same surgery without opening the chest. We can do smaller incisions, usually sometimes even under the arm, where they're a little more cosmetically accepting. And that's something we've seen become more popular over the last few years. But probably about 7 or 8 years ago, the biggest advance has been the development of what we call transcatheter valves. These are valves that either come from a pig or a cow. But what we can do is actually compress those valves to a very small size over a balloon. And from there, they can be delivered up to the heart, usually from the leg, where they can then be re-expanded inside of the heart. And so that's a way of replacing the valve without opening the chest, without stopping the heart. And it's really revolutionized heart surgery. Patients commonly go home within a day or two following these procedures. And you're right, it's become very safe. Actually, when you compare the results of that procedure as compared to what we were traditionally doing, it's either the same or in a lot of cases even safer than doing an open surgery. And for that reason, transcatheter valve replacement is now more common in the U.S. than doing open surgery.
After having a procedure like that, what kind of medications does somebody need to be on?
Well, to be honest with you, a lot of times they're on less medication because now you've fixed this problem. Patients are less likely to have heart failure and things like that, less likely to have fluid develop in their extremities, and so the goal is actually to be on less than they were on before. But still, most patients will require some medicines in terms of managing their blood pressure. Aspirin is a common thing that we'll recommend. And then rare patients may even need blood thinners like Coumadin. But again, with surgery, the goal is to try to make it where patients don't have to be on as much.
When does somebody need open heart surgery? I know you try to avoid it, doing these different things, but when are the cases where somebody does need open heart surgery?
Well, the most common indication to have heart surgery in general is going to be if you develop symptoms. And so, if you're having to limit your lifestyle because of symptoms that you've developed, that's an indication to have the valve replaced or repaired. Some patients, though, will discover this in absence of symptoms, but a lot of times even those patients will need surgery if the degree of narrowing or leak of the valve is severe. In terms of who will need open surgery, we still have to do open surgery on occasions. That's more commonly going to be in young patients because, again, these transcatheter valves, although they've revolutionized heart surgery, they're still tissue valves and they'll still degenerate over time, which in an older person may not be an issue, but in a younger person it can be, and it could wear out during their lifetime. And so oftentimes in younger patients we have to choose an alternative that's going to be more likely to last their entire lifetime, usually a mechanical valve.
Thank you so much for answering our questions today. We appreciate it. Is there anything else you might want to add? This was helpful for me. I've learned some things myself.
Well, again, this is a very exciting time for heart surgery because things are changing very rapidly with technology. And so sometimes patients are reluctant, to see their physician, or if they're even informed that they might need heart surgery, may, shy away from that. But now with all the different options we have available and these less invasive options, it's certainly a good idea for any patient that has symptoms to see their doctor about those.
Thank you so much for your time today. Thank you.
Mm-hmm.